So this is a season that lots of new parents dread. It's RSV season. So RSV is respiratory syncytial virus, and it causes a lot of cough, congestion, nasal drainage in young infants. The folks that we worry most about are newborns. So those kids less than 2 months old are typically the ones that are going to have the most trouble, and especially those who are born at 29 weeks or less, and those with congenital heart disease, cystic fibrosis. This virus can be very troublesome to them. However, it's a pretty common virus. All kids by the time they reach 2 years old have had it. The treatment is mainly supportive care. So trying to keep their nose sucked out, making sure they're not getting dehydrated, those are the things that we try to watch out for. Only 1 to 2 out of 100 will require hospitalization, although we all seem to remember those that have been very sick from RSV. So what can you do? Wash hands. Keep them away from other sick children. The RSV virus can actually live on countertops and things for up to 6 hours and can live on someone's hand for about 30 minutes. So good hand washing, alcohol, hand gel, soap and water are important. The things that you need to do to try to keep your child well are, if there are other sick kids in the house, then try to keep them away as much as you possibly can. If you're taking them to a nursery or a daycare, stay informed as to see if RSV is kind of running through that nursery or daycare. There's not a whole lot you can do because it is the season, but you just want to be mindful of that. The reasons that you might need to seek medical attention is if the child's running fever, if the child is struggling to breathe. When you look at the child, the chest is sinking in, caving in, and they're not eating or drinking as well, or they're just lethargic. They're just not quite acting themselves. It's never wrong to come in and get them checked out, but most of the time, RSV is a benign illness and it will resolve without any extraordinary treatment. As always, if you have any questions, we're always willing to help.